Hi and welcome. I'm trying to learn medicine, today cholera, and after we've done that, we're gonna do standing yoga. And if you participate in the standing yoga, then it's been at down risk. And we're talking about a disease and internal anatomy and the happenings of this disease. And also, this is no medical advice, we're just learning about it. I'm just reading what's here. Cholera. That is an acute infectious disease that can occur in epidemic form throughout the world, but not in Britain. That book is from Britain, from a British perspective. So it can happen in basically all over the world, but it is not usually in Britain, for example. It is an acute infectious disease, so it can be transmitted. It is caused by a germ called Vibrio cholerae, which is found in the feces of patients. Yes, we're going to talk about these things. Feces of patients and carriers. Cholera is transmitted by contaminated water and flies, and spreads rapidly when sanitation is poor. A natural disaster, such as an earthquake or flood, may result in an epidemic. Okay. Cholera is transmitted about a germ. It has a name, Vibrio cholerae. And this germ can be in the feces of patients and of all carriers. And it can be transmitted about water, which is contaminated, as also about flies. And it spreads very rapidly if the sanitation are poor. And that can be rapidly increased if there's a disaster, an earthquake. Symptoms. So we're going to talk a lot about defecation. Symptoms. Watery diarrhea. This is painless but very severe. Vomiting, which is often effortless and without nausea. I have to find my name about nausea and vomiting with all this. What the difference is there? The loss of fluid produces rapid weight loss and muscle cramps. So the people are losing a lot of water. They're getting dehydrated because they have watery diarrhea, and they are vomiting a lot, which is effortless and without nausea, but they're losing a lot of water, and they're getting muscle cramps and losing a lot of weight. Incubation period 6 to 48 hours. So already 6 hours after they were infected by this Vibrio cholerae, they can get it, the outbreak of a disease, but also 2 days later, 48 hours. Duration, 2 to 7 weeks. 2 to 7 days. 2 to 7 days. Causes, bacteria in water and uncooked food, especially fruit and vegetables. Causes bacteria in water and uncooked food, especially fruit and vegetables that have been contaminated by carriers. Okay, there can be bacteria in the water if people drink water in which this is, or also if people eat uncooked food which are contaminated, and especially is it for fruit and vegetables that have been contaminated by carriers. Now I want to know more about these flies. If it is a main way to transmit it or what is in the treatment in the home. If immediate medical help is not available, keep the patient at complete rest. So rest, do I say? Give plenty of glucose water and iced drinks such as lemon and barley water. Again, this is no medical advice, and this book is from the 80s. Give plenty of glucose water and iced drinks such as lemon and barley water. When to consult the doctor? Immediately. If cholera is even just suspected, if cholera is suspected. What the doctor might do: arrange an intravenous saline drip to replace lost fluid. Once the fluid is replaced, recovery is rapid. Okay, we're getting an intravenous injection, and there comes water with saline. I think it's also some type of salt water, whatever. We're getting that in. But I'm not sure about it. It's saline water. This is all medical advice. This is not medical advice. Prescribe antibiotic injections or tablets. All of this is less important than replacing fluid lost through diarrhea. So we have to get water again in because we're getting dehydrated because we're losing so much water. So we're also into antibiotics and antibiotic injections, but it is the saline water. This thing. Again, this is now medical advice. Prevention. Be immunized. There's immunization. Be immunized against cholera if you are going to a country where the disease occurs frequently. Immunization lasts about 6 months, but it's not always effective. Again, this book is from the 80s. Maybe someone has made a better immunization, but there is a type of immunization. I don't know to what to what success, but for 6 months, and people should take it if they go into regions where the cholera can be present. People being immunized for the first time should be immunized again after 10 or more days. In countries where cholera occurs, all water should be boiled, and food, especially fruit and vegetables, should always be well cooked. Careful. Personal hygiene and good sanitation in the community are the only sure protection against cholera. In countries where cholera occurs, all water should be boiled, and food, especially fruit and vegetables, should always be well cooked. And overall good sanitation. Outlook: with adequate treatment to replace the large amounts of fluids lost from the bowel, recovery is complete and there is little chance of a patient dying from the disease. When epidemics occur suddenly, such as after a flood or earthquake, hospitals cannot always cope with the number of patients needing treatment, and the death rate in the early phase of an outbreak may be as high as 60%. Is there not vaccination yet? No, longer than 6 months. Okay, cholera. The problem is that there is this Leber cholerae, and that is a germ, and that can be in different things. It can be in water, it can be in uncooked food, it can be also transmitted through flies. And if people be in regions where it is, before they get there, they should some type of injection, immunization against it. And the people who live there probably, I don't know what they can do about it, whatever. This is a British perspective. Now, the people should get immunization if they go to these countries where it is, whatever the people know what hospital they have it. All over is good sanitation, which is then the final solution against it. And if one is in an area where it could be, the water should be always boiled, and also the food should be cooked, and fruit and vegetables should also be well cooked. If treatment happens immediately through saline injections, then the massive water loss through a watery diarrhea can be replaced, the person survives. If there's an outbreak after an earthquake and thousands of people have it at the same time, there are not enough intravenous and saline injections, and not all people can be treated, and 60% die. Now, that's the medical part. Now we're going to do steady yoga. If you are here for cholera, you can go directly to the next part. If you are here for steady yoga, we're going to do it now. If you participate, then it's better the outlook. Wir haben the feet standing together and we're breathing in and breathing out. And breathe out the arms down. And breathe in the arms up. Can people get it twice? And again the arms up. And out the arms down. No. Police officer, breathe in the arms up. And breathe out the arms to the side. In the arms up. Out up and on the other side. Again in the arms up. Out up the arms to the side. Out to the other side. Again. And out, lean back, draw the shoulder blades together. In and up. And out and lean down. Lean back. In and up. Hands together and lean back. And up. And down and lean back. And out over to one side. In into the middle. Out to the other side. In into the middle. Out across the arms, intertwine the fingers, reach high as glue. Without reaching front. In. Change it, intertwining, and breathe in, reach high. And out, reach in front. Follow the back. In and up. Out with the arms down onto the knees. And doing standing cat and cow. And out, make a hell of a back, the cat. Again, in, straight back. And out the belly, cow. In. And out the cat. Again, in. Out, cow. Again, in. And now we're coming around, back up, and then making it to the top and backwards, shoulder drop. And now an inch space between the toes, breathing in as with the arms up. Without opening arms to the side. And a little out and sink down into half chair. Breathing in, come up. Out on the other side. In. And out and down. In and up. Out and up again to one side. Again in. Now we absorb sides down, we're going down into chair. Breathe in, come halfway up. Higher. And out and coming up. Breathe in and reach high. And out, open the arms to the side. Okay. And out, we bring the arms on the sides down, going down. Breathe in, come up. Higher. And out and down. Breathe in, come up onto tiptoes. And breathe out, sink down into the full chair. Breathe in, come up again. And out and down. And up and up. And now we're down diving dolphin, bring the arms over the sides down, and we're hanging down. And we're doing the marmot. Breathe in, bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Again, in and change. And out and stretch the left leg. In and change. And out and stretch the right leg. In and change. And out. In. And out. And out, stretch both legs at the same time. Now a penguin. Breathe in and lift the right hand up to the sky. Breathe out, bend the left knee, look off the right shoulder to the right hand. Again, in the shoulder down, down, up, out and down, both legs straight. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee, look over the left shoulder to the left hand. Again, inhale down, and out and down. And now the pelican. Make a hand of space between the feet, shift the weight over heels, and breathe in and go down. And breathe out and come up again. Again, in and down. And out and up. In and down. And out and up. And now the Chibushi is counting it. Take out on the elbows and gently rock from side to side. Arms down, feet together. Breathe in, come halfway up, straight back into monkey half lift. Breathe out and down. In, halfway up. Out and down. And then we're going to come up with the up-diving swan, hands together, hands again down. And we stretch the fingers for tussle up. No, just go to the stance. Intertwine the fingers behind the back and bring them over to one side. Tall up, shoulders back, breathe in. And out, head over to one side, and the chin down to the curve. Breathe again in. And now pull the arm in and shoulder down. Again in, head up, over to the other side. Breathe again in. Out, pull the arm in and the shoulder down, hold the chin down to the curve. In, head up, back into the middle. Now the feet again standing together. Breathe in, lift the arms up. Breathe out, lean back for sky hug. Head into the middle. Out and lean back. Okay. Out the arms down. Now the eagle swings. Breathe in, lift the arms up. Out the arms down. In the arms up. Out and down. And now the cactus collecting its stings in the evening. We winded the arms up. Bring the hands to touch, along the hands down to heart center. That was the standing yoga. I thank you very much, and until next time.